Welcome to this model. And this model I'm going to speak about endoscopy or endomicroscopy. Endoscopy is the insertion of a long thin tube directly into the body to observe the internal organ or tissue in detail. It can also be used to carry out other tasks including imaging and minor surgery. Endoscopes are minimally invasive and can be inserted into the openings of the body such as mouth or anus. Alternatively, they can be inserted into small incisions, for instance, in the knee or abdomen, and surgery can be completed through small incision and assisted with special instruments such as endoscopic, that is called keyhole surgery. Because modern endoscopy has relatively few risks, delivers detailed images, and is quick to carry out, it has proven incredibly useful in many areas of medicine. Today, tens of millions of endoscopies are carried out each year. And optical fibers play a vital role in medical field. So endoscope or fibroscopes are designed with low quality, large diameter and short silica fibers. Bronchofibroscope, gastrointestinal fibroscopes and laparoscopes are the important endoscopes. Endoscopes are used in hospital for examination, treatment of diseases and surgery. And there are two types, that is flexible and rigid type. So in each endoscope, there are two fiber bundles. One is used to illuminate the inner structure of the object and the other is used to collect the reflected light from that area, and from that we can view the inner structure of the organ. And the endoscope is an optical instrument to view the body cavities which are not visible to naked eye. Endoscopes can be inserted to inspect or view the body cavities. The body is filled with air to improve optical transmission. The light is guided through glass fibers by total internal reflection. A typical glass fiber consisting of a central core glass which is having a high refractive index surrounded by a cladding, and which will be made by a glass with a slow or lower refractive index. The numerical aperture of the fiber is equal to n1 squared minus n2 squared divided by 2, where n1 and n2 are the refractive index of the core and cladding respectively. For better image quality, a telescope system is added in the internal part of the endoscope. Reflected light rays are collected by CCD and electrical signal share produced and which are fed to the video monitor to get image. Thorough on-channel endoscope of water and air is conducted to wash and dry the surgical site. Endoscopies are quick and relatively safe procedures. The first endoscope was designed in 1806, and the main reasons for endoscopy are investigation, confirmation and treatment. Endoscopies can be used to remove tumors and polyps from the digestive tract. A surgeon introduces the endoscope into the body either through a body opening or such as mouth or anus, or through small incision in the skin. The endoscope gives the visual evidence of the problem such as ulceration or inflammation, and it can be used to collect the sample of tissue or remove the problematic tissue such as polyps. It is used to take photograph of the hollow internal organs. In the endoscope, at the object end there is an assembly of objective lens and prism, and at the viewing end there is an eye lens. Endoscope pictures can be recorded with the color film and videotape recorders. This diagram shows the flexible endoscope and the observation using endoscopy, and this diagram shows the rigid endoscope. And there are different types of endoscopics are available. And for example, bronchoscope, cardioscope which deals with heart activities, and cystoscope deals with the urinary bladder, gastroscope deals with the stomach and so on. And endoscopy is useful for investigating many systems with the human body. For example, gastrointestinal tract which is useful in verifying the stomach or small intestine, large intestine, duct, rectum and anus. And respiratory tract is useful for nose and lower respiratory tract. And here is otoscopy, and urinary tract is cystoscopy. And female reproductive tract is cervix, uterus and fallopian tubes. And through small incision, abdominal or pelvic cavity, interior of a joint, organs of the sex. Capsule endoscopy was developed in the mid of 1990s and involves a wireless camera. The camera is small enough to fit into the capsule and can therefore be swallowed. As the capsule travels through the digestive tract, it takes thousands of pictures which are transmitted to a device attached to a wearable belt. The capsule endoscopy is used to image the small intestine, a region that is difficult to image using a standard endoscopy. It is also very useful for examining the small intestinal mucosa or diagnosing the Crohn's diseases. And the capsule usually passes through the digestive system within 24 to 48 hours. This is relatively a new technique and was given FDA approval for use in the United States in 2001. To date, more than 5 lakhs capsule endoscopy procedure have been carried out and nearly 1,000 articles have been published covering this clinical use. The procedure doesn't require an overnight stay in the hospital and usually only takes around 1 hour to complete. The doctor will provide instruction about the preparation and procedure. For many types of endoscope, the individual needs to fast for around 12 hours, though this varies based on the type. And for procedures investigating the gut, the laxatives may be taken the night before to clear the system. A doctor will carry out an examination before the endoscopy. It is important to mention all current medications and any previous procedures. And the procedure will depend to some extent on the reason of endoscopy. And there are 3 main reasons for carrying out an endoscope. One, first is investigation. If an individual is experiencing vomiting, abdominal pain, breathing disorders, stomach ulcers, difficulty swallowing, or gastrointestinal bleeding, for example, an endoscope can be used to search for a cause. And the confirmation of diagnosis, second one is, that is, endoscopy can be used to carry out a biopsy to confirm a diagnosis of cancer or other diseases. And the third category is treatment. That endoscopy can be used to treat the illness directly. For instance, endoscopy can be used to seal using heat, bleeding vessels, or remove a polyp. Sometimes endoscopy will be combined with another procedure such as ultrasound scan, and it can be used to place the ultrasound probe close to organs that can be difficult to image, such as pancreas. Modern endoscopes are sometimes fitted with sensitive light that use narrowband imaging, and this type of imaging uses a specific blue and green wavelength that allow the doctor to spot the conditions more easily. An endoscope is typically performed while the patient is conscious, although sometimes the patient will receive local anesthetic. Often the patient is sedated, and for endoscopy procedures involving entry through the mouth guard will be used to protect the teeth and lips as the tube is inserted. Endoscopy has advanced in recent years, enabling some forms of surgery to be conducted using a modified endoscope, and this makes the surgery less invasive. Procedures such as the removal of gallbladder, sealing and tying the fallopian tubes, and the removal of small tumors from the digestive systems or lungs are now commonplace. A laparoscope is a modified endoscope used for keyhole surgery. A laparoscope surgery requires only a small incision and can be used for appendicitis and hysteromitis and the prostatitis. And using this technique, patients lose less blood during and after surgery and can recover much faster compared with the standard surgical procedures. Endoscopy is relatively a safe procedure, but there are certain risks involved. Risks depends on the area that is being examined, and the risks of endoscopy may include oversedation, although sedation is not always necessary, and feeling bloated for a short time after the procedure, and mild cramping, numb throat for few hours due to the use of local anesthetic, infection of the area of investigation, and this most commonly occurs when additional procedures are carried out at the same time. The infections are normally minor and treatable with a course of antibiotics. Persistent pain in the area of endoscopy, perforation or tear of the lining of stomach, and internal bleeding, usually minor and sometimes treatable by endoscopic catheterization, and complications related to pre-existing conditions. And recovery will depend upon the type of procedure. And now let us have an insight of endoscopic laser coagulator. and it uses argon ion laser as a high energy optical source and endoscope as the delivery unit. Considerable clinical experiences has accumulated in the use of organ lasers in ophthalmological procedure involving photocoagulation. By scaling the power requirements of the practice, power level of about 10 watts was found suitable for the control of gastric. And the organ laser beam is transmitted with the via quartz fiber waveguide, and it can be inserted into the gastrointestinal fiber optic endoscope. With advances in quartz fiber technology, fiber optic delivery of an adequate dosage of visible or near IR radiation is possible. And a gastric photocoagulator can be inserted into the biopsy channel of a conventional flexible endoscope for non-invasive control of gastric bleeding. So the system employs a water-cooled argon laser capable of delivering more than 13 watts continuous radiation when operating with all standard atomic lines. The system makes use of a special purpose beam splitter to provide an aiming beam of the endoscopist at a preset and well controlled operating level. So at the same time, the laser power can be adjusted and monitored prior to the firing, and the high power beam is transmitted to the flexible quartz waveguide by triggering the electronically controlled solenoid. The solenoid shutter can be adjusted in 0.1 second steps from 0 to 760 seconds, and the quartz fiber is encapsulated in a laminated sheet, and this provides the physical protection and enables easy transport of the biopsy channel of a conventional endoscope. With approximately 14 watts of laser radiation available, about 10 watts can be deposited distally, and pilot studies with experimental animals have shown that the system can be easily adopted and operated with a conventional endoscopy procedure. Rapid hematosis was observed in experimental animal studies using this technique, and although the endoscopic photocoagulator system has been found to be functionally reliable on animal experiments, and this has some limitations. That is the major problem here is that it is difficult to control severe bleeding more than 2 cc per mm, as the technique can photocoagulate only low to moderate bleeding ulcers quite well. And organ lasers are very useful for the coagulation of blood vessels, since its green light is highly absorbed by red blood vessel cells and hemoglobin. The absorption of green light results in the photocoagulation of blood protein and microhemostasis. Organ laser is useful for the photocoagulation of retina because the ability to do coagulation without affecting the surrounding healthy issue. And to control the gastric photocoagulation techniques can be used, and in fiber optic endoscope, output from organ ion laser is delivered to required spot to arrest the gastric bleeding. We can move the laser beam in any direction with a flexible endoscope. The organ ion laser will give an output of 13 watt, as I said earlier, in the form of continuous waves. And the diameter of the quartz fiber endoscope is about 2 mm. And this diagram shows the structure of the block diagram of fiber optic gastric and photocoagulator. And this a jet stream of gas, carbon dioxide, were blown on the bleeding site while the laser radiation was being emitted. The overlying blood would be blown away and the laser radiation would reach the vascular level. Thus, it will be more effective in achieving hemostasis than laser radiation alone. Also, the gas flow helps to prevent any contamination at the output tip if it were directed around the optical fiber during the photocoagulation process. So, the construction of the catheter is detailed by these workers, and this endoscopy remains to be determined as to what type of bleeding from what size vessels is suitable for laser therapy. Thank you.